This lecture will provide an introduction to anatomy and physiology. This lecture segment, Part 4 of 4, will cover important anatomical terms, body sections, regions, and positions, as well as the cavities of the body. When communicating about the human body, it is important to use the correct terminology. Medical terminology refers to terms that describe body regions, anatomical positions and directions, as well as body sections. This language is important in the medical community as it allows for effective and accurate communication regarding the human body. When the body is in anatomical position, hands are at the sides with the palms facing forward and feet are together. The term supine refers to lying down in the anatomical position with the face being up, and prone refers to lying down in the anatomical position with the face being down. This figure shows the anatomical position from the front or anterior view, and the figure on the right shows the anatomical position from the back or posterior view. Important anatomical landmarks are labeled on both figures, as well as descriptive words that are used to describe regions. These landmarks will be referred to throughout the course. Let's take a look at some. We see the cephalon, or head, the cranium, or skull, the nasus, or nose, oculus, or eye, oris, or ear, oris, or mouth, axilla, or armpit, brachium, or arm, antecubitus, or front of the elbow, antebrachium, or forearm, carpus, or wrist, pollex, or thumb, digits, or phalanges, which can refer to fingers or toes, the patella, or kneecap, tarsus, or ankle, hallux, or great toe, and pes, or foot. The trunk consists of the thoracic region, or thoracis, the mamma, or breast, the abdomen, the umbilicus, or navel, and the pelvis. Manus refers to hand, pubis, the femur, sometimes described as femoral, and the groin, sometimes described as inguinal. On the posterior view of the anatomical position, we see acromial, sometimes used to describe the shoulder, dorsum, or back, olecranon, or back of the elbow, the lumbus, or loin, lumbar region, gluteus, or buttock, popliteus, or back of the knee, sometimes described as popliteal, calcaneus, or heel, and planta, or sole of the foot. It is important to note that when using the terms left and right, always, always, always refer to the left and right sides of the subject, not of yourself. This is very important as mistakes such as performing surgery on the wrong side or x-raying the wrong limb can occur if these terms are used incorrectly. Let's go back to the previous slide and take a look at this. So in this case, in the anterior view of a subject in anatomical position, we're going to see that this person's left side is over here and their right side is over here. When we look at the same subject from the posterior view, we're going to see that the right side is here and the left side is here. It is very, very important to understand that when we use the terms right and left, it's always with reference to the right and left sides of the subject, not to the observer, not to yourself. This is something that you should keep in mind. The abdominal pelvic quadrants and regions break the abdomen into sections. The abdominal pelvic quadrants include the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. So we can see how the abdomen is split into 4 regions The first being the right upper quadrant, the second, the right lower quadrant, the third, the left upper quadrant, and the fourth, the left lower quadrant. In the case of the abdominopelvic regions, the area is divided into 9 sections, providing more precise locations to use as descriptors. Here we see the right hypochondriac region, the epigastric region, the left hypochondriac region, meaning below the ribs, or the right and left lumbar regions. Here we have the right and the left lumbar region. The umbilical region, easy to remember because of the umbilicus being there. The right inguinal region, the left inguinal region, and the hypogastric or pubic region. Directional terms are also very important. The diagrams here demonstrate the different directional references that are often used when communicating about the human body. Anterior or ventral refers to the front or belly side. Posterior or dorsal refers to the back side. Cranial means towards the head. Caudal means towards the tail. Superior refers to above or at a higher level. Inferior refers to below or at a lower level. Lateral means away from the longitudinal axis of the body, and medial means towards the longitudinal axis of the body. Proximal means towards an attached base, and distal means away from an attached base. Two terms not shown on these diagrams but often used are superficial and deep. Superficial means at, near, or close to the body surface, and deep refers to something farther away from the body surface. This table provides a summary of directional terms that will be used throughout this course and is a handy reference when first learning these terms. Here we can see that the term such as distal is given. The region or reference it refers to, distal means away from an attached base. And then we have an example of how this will be used to describe something in the human body. The fingers are distal to the wrist. Moving distally from the elbow brings you to the wrist. So we're moving away from that point of arm attachment at the shoulder towards the fingers, so that would be referring to be moving distally down there. This is a handy chart to reference when you're first learning these terms. Moving on to sectional anatomy. Sectional planes refer to slices taken through a three-dimensional subject. Three main planes used when discussing the human body are the transverse plane or horizontal plane, which divides the body into superior and inferior portions, the frontal plane or coronal plane, which divides the body into anterior and posterior portions, and the sagittal plane, which divides the body into left and right portions. Here are visual representations of the body planes. The transverse plane, seen in green, will cut the body into superior and inferior portions. So a superior and inferior portion. A transverse plane looks like this. In the case of frontal plane, the subject will be cut into an anterior, a front, and a posterior back portion. That's denoted by the purple plane shown here. So we'll cut the person into a anterior portion and a posterior portion. This would be what a frontal plane looks like. The sagittal plane will cut the subject into right and left portions, and is denoted by the blue plane. So this plane here we'll go ahead and slice through the three-dimensional subject, showing a left portion, and then on this side, a right portion. This is what a sagittal plane would look like. There are two main regions discussed when referring to body cavities, the thoracic and the abdominopelvic. The cavities of the body are designed to protect the internal organs they house and allow for the organs to change shape without hindering the functions of other vital components. For example, the expansion of the stomach after a large meal in the abdominopelvic region. The internal organs that are housed in body cavities are known as the viscera. A serous membrane that secretes serous fluid lines the cavities and the organs that reside there. This membrane produces serous fluid that reduces friction between the organs and between the organs and the cavity walls. The membrane on the walls of the cavity is referred to as parietal, and the membrane that covers the organs or the viscera is referred to as visceral. Here, the thoracic and abdominopelvic cavities can be seen. The diaphragm separates the two. The thoracic cavity has three internal chambers, one pericardial cavity and two pleural cavities. Each one is defined by a serous membrane. The heart occupies the parietal cavity, and a lung occupies each pleural cavity. Again, the pericardial cavity contains the heart and is found in the mediastinum. The layer of serous membrane that covers the heart is known as the visceral pericardium or epicardium. The parietal pericardium is the outer layer, and the space between the two, the pericardial cavity, holds the serous fluid. The way the heart sits in the pericardial cavity is analogous to how a fist can project into a balloon. The pleural cavities shown here will each house a lung. So we see one pleural cavity and the second pleural cavity. The visceral pleura refers to the layer that covers the lung, and the parietal pleura defines the edge of the mediastinum and lines the inner surface of the chest wall. The abdominopelvic cavity, found below the diaphragm, is subdivided into the abdominal cavity and the pelvic cavity, with the superior margins of the pelvis marking the start of the pelvic cavity. It is important to note that there is no physical separation between the two cavities. The visceral peritoneum covers the internal organs found here, and the parietal peritoneum lines the inner surface of the body wall. Let's review with a checkpoint. What is the purpose of anatomical terms? Please feel free to pause the lecture while you formulate your response. Anatomical terms give us standard language to use when describing the body. Let's try one more. If a surgeon makes an incision just inferior to the diaphragm, what body cavity will be opened? Recall that inferior refers to below, so just inferior to the diaphragm, we'll put the incision over the abdominopelvic cavity. So, the abdominopelvic cavity will be the cavity that is opened by the surgeon.